These are some basic ball exercises for when you are first hurt, a way to get out of pain. These balls are great for the correct size. We'll prescribe the correct ones for you. If you're about 5'8", which I am, 55 centimeters is about where you want to be. You'd have to be below 5'2" to have a 45 centimeter ball, and above 6 feet you'd want to get a ball that's along the lines of 65 centimeters. But when you're first hurt, you want to start with these sitting exercises, and all we kind of do here is just tilt the ball a little bit side to side. The idea is to gently relax the back muscles so that they can feel comfortable with moving. Sometimes your back's really guarded and it's stiff and it thinks that if you move you're going to hurt more, so you just want to gently introduce motion that does not hurt. Forward and back as well. Very simple, just tighten the abs, stay within your pain tolerance. So arch back, nice and slow. You could also do them in circles. You could also introduce a little bit of rotation, rotating to the side. Again, stay within your pain tolerance. The idea here is to train the back to know that motion's okay, so that spasm and guarding, your body doesn't feel it needs to do that anymore. During this set of exercises, we'll be reviewing exercises for the ball, where you're lying on your stomach. These are great for correcting discs and back injuries. Again, only do the exercises that we've prescribed to you, but this is how to correctly perform them. The idea here is to get on the ball. The ball can be a little bit above your waist, right at your waist, and then you're going to be pressing up. Changing the ball position under your waist is going to affect a different part of your lumbar spine. So if I work the ball a little lower, I'm going to be working lower lumbar spine. I like to try 3 different positions. Move the ball, right under your belt, at your belt, and a little bit above. That way you're covering pretty much all of your lumbar spine. Again, hold 15 seconds, 30 seconds, tighten your butt a little bit for a little extra effect. And you'll feel your muscle relax as you hold. That's your idea. Good. After your stretch, you can actually do the strengthening portion. Same idea, 3 positions will affect different parts of your low back. You can put your hands behind your back, or you can put your hands on the ball. Just don't use them to support you. But the idea is to lift up just like this. Tighten the back. Imagine arching your back and doing it all here. Nice and fluid, slow. Good. You do a set of 10, and then you can move the ball down and do another set of 10, so it's in the lower part of your back. Up and down, just like this. Good. Tighten that back and arch it. Good. This exercise looks difficult, but it's not that hard. All you're doing is your next exercise I call the double leg raise. You put your hands on the floor and you lift your 2 legs. And you want to focus on doing it by tightening your butt and arching your back. You're not lifting your leg as much as you're arching your back. You don't have to go too high, you don't have to dip down. Just tighten the back. And when it doesn't go any further, sometimes I see people doing this, but that's the improper way of doing it. Just tighten, and if that's all your body naturally gives you, that's what you do. Good. You could also do opposite arm, opposite leg. Takes a little more coordination, but it's good to train the stability of the back to respond to different motions.
Today we're going to do 2 stretches and a strengthening exercise. Again, only do what's prescribed by your therapist. Alright, starting off, we're going to do a side bend stretch, nice and easy. You're going to be on top of the ball. This one, just keep your pelvis nice and level and nice and easy. Arm over top, come on down. You're going to hold 15 to 30 seconds and then gently come up. To add some rotation, you can move your pelvis a little bit forward or a little bit backward. And nice and easy, same principle, coming nice and easy over the side. Hold 15 to 30 seconds and then come back on up. To do the strengthening, you want your pelvis level. I like arms over chest. Come on down, slow and controlled, and come on up. Again, should be fluid, no trying to cranking them out. You're going to lose your form, and that's not what we want.
These next set of exercises are going to be based on you lying on the ball, more on your back. Like I said, I prefer to do abs here because the contour of the ball fits your back, supports it much better. But same principles, you want to do your crunch, you want to come straight up. Straight up. But you can do it a little better now on the ball than you could if you were just on the mat. And the back is much more supported. And you're working actually a little harder, so you get more out of it. Again, tighten the abs, come straight up. If you want to work your obliques, the ball naturally slides with you a little bit too, so you can get a little more out of that. You come, try and bring that chin up. You don't want to be coming off the ball like that. Up. Try and almost point your chin up. Good. That's the correct way of doing it. And ab crunch. We also do things we call the bridge. You can also do the bridge here. We've done these before on the mat. But again, it's butt down, butt up. Butt down and butt up. Try and get good arch in there. Butt down and butt up. To progress that a little bit, we do the bridge march, which is a little tougher. You have the ball supported under your head between your shoulders, arch your back, and kind of go back and forth like this. In order to march, you're going to need to move the ball to the side a little bit to balance. That's the trick to this. So when I'm lifting my left leg, I'm moving the ball to the right a little bit. That gives me a little more support. You can also do the bridge one leg extension, where you put one leg forward and you come up and down. Now this is a very advanced exercise and works only one part of the spine. Again, only do these if prescribed. So leg down, leg up. Put one and try it with the other one. You may notice that you're weaker on one side than the other. Asymmetry is hard on the back, and you need to strengthen both sides equally to really get a maximal effect out of these. So if you feel weaker on one side, focus on that weaker side. 3 sets of 10 there is a common prescription. Another stability exercise that's more on the advanced side is to fold your elbows up like this, and your chest is separated from the ball. Prop yourself up, and then lift, lift, lift. This is tough. All you're doing here is lifting with your back. You may need to shift the ball a little bit. Stay stable. It's not easy, but when you're ready for exercises like this, once you get strong here, you're going to feel a lot better.